Tonight, a local woman has asked for help. She's still getting medical bills for her mother, but that shouldn't be happening. They're coming from a company we've spotlighted in a couple of stories, APP of Tennessee. 10 News reporter Vinay Simlot joins us. And Vinay, a familiar story after you started asking more questions, right?
Robin, APP cleared the bill and removed the collection claim. That's the third time. So far, we've found about $14,000 worth of bills, all from the same company, all to Medicare patients. In a difficult 2022 for Vicki Mash,
it was just one thing after another.
Her brother died of COVID. Soon after, Vicki's mom, Sarah, her health declined quickly.
Septic, cellulitis, MRSA, pneumonia.
The loss forced Sarah into the hospital for months.
We actually stayed at the hospital more than we did at home, just about.
Sarah died in May, leaving Vicki with stress and sorrow.
I still wanted to take care of her debts.
One of the debts came from her mom's visit to Jefferson Memorial. Vicki got a bill for more than $7,000 from APP of Tennessee. The company contracts emergency room doctors at hospitals in Tennessee.
Oh, it was very stressful. I mean, trying to figure out how to actually come up with the money to get these bills paid.
Sarah isn't the only Medicare patient who's gotten bills from APP of Tennessee after an emergency room visit. In March, we brought you the story of Harold Cox, who got a $2,000 bill from APP of Tennessee. After that story aired, we've seen bills sent to Mary Newman, Ferris Cameron, and Eileen Reinhart. Bills, all to Medicare patients, all totaling thousands of dollars. In one case, they say the patient didn't send the necessary information for Medicare to bill. In the second, Medicare didn't accept the claim, but the insurance company resubmitted it. In Vicki's mom's case, APP says her insurance company didn't accept the claim at first.
Just because someone says you owe it doesn't mean you owe it.
Bill Maddox, a local billing and bankruptcy attorney, says he's seen cases like this.
The healthcare provider simply is not billing correctly. It either has information wrong, birth date, an ID number.
He says if that happens to you,
it sometimes just takes some pushing back to make sure everything's coded the right way.
Bottom line, he says Medicare patients shouldn't be getting bills from the hospital, especially if they're in the emergency room. And he says if you get them, you shouldn't pay them. He says work with the provider and your insurance company to make sure everything's correct. His advice, number one, ask for written proof you owe the bill. Number two, check your credit. If a company mistakenly says you didn't pay your bills, that could affect your credit. And if it does, you should call your lawyer. Number three, Medicare patients should not get bills ever.
My mom, even though she's gone, I still want good standings for her.
Vicki's happy her mom's bill got cleared. Now she worries about the people who don't have someone advocating for them.
That's not right. I mean, they worked all their life to, have their benefits, so let them have them.
Again, this story is about Medicare patients. If you go to an emergency room, you should not get a surprise bill. But starting on January 1st of this year, this same thing applies to anyone with private insurance too. You shouldn't get a surprise bill if you go to an emergency room. Now, if you do get a surprise medical bill, call the medical provider and your insurance company. If that still doesn't get resolved, we want to hear from you. Send your bill to iteam@WBIR.com. Robin?
All right, Vinay, thank you so much. We appreciate that.